Hello, welcome to my Nclex prep channel. So in this video, we will talk about the very most important topic for Nclex exam and any other exam, which is phenytoin medication. And it's anticonvulsant medication. So we use for the epilepsy and other chronic seizures disorder. That means it's a long-lasting medication. But for your exam, you have to remember the therapeutic range, which is 10 to 20. So if it's the less than 10, that means also report to the HCP because higher chances to get the seizures. And if it's greater than 20, then also report to the HCP because it's a phenytoin toxicity. But in your exam, they don't ask directly phenytoin toxicity, but they will give you the sign and symptoms of the phenytoin toxicity. So you have to remember the sign symptoms. So what are the sign symptoms? So early signs of the toxicity is ataxia, that means incoordination of the movement. Second one is hand tremor, and the third one is slurred speech. If you can't remember the sign symptoms, then think about the drunk climb. So what are the expected side effects? So bradycardia and hypotension. Since it's a CNS depressant medication, so it's the expected side effects. Second one is gingival hyperplasia. So it's inflammation of the gums. So teach your patient, if the patient has a next dentist appointment, then teach your patient to inform the dentist that patient is taking the phenytoin medication. But what are the other adverse effects that also you need to remember for your Nclex exam? The first one is suicidal ideation, which is highest priority, and the second one is the skin rash. In the exam, if they say the new or the painful skin rash, that means it's a priority because it's a sign of the Stevens-Johnson syndrome. Also, in the suicidal ideation, they don't give you directly in the exam, but they will give you something like this, like I am finding to stab by myself or something like that. So what are the teaching that you need to teach your patient? So if patient is on oral contraceptive methods, then ask your client to use another contraceptive method because phenytoin decreases the absorption of the contraceptive methods and patient can accidentally become the pregnant. The second one is do not stop the abruptly. So phenytoin medication, taper down the dose, do not stop right away. The third one is take the folic acid, calcium and the vitamin D. Since it decreases the synthesis of the folic acid and decreases the absorption of the vitamin D, teach your patient to take the vitamin D and calcium and the folic acid contains food such as the milk, cantaloupe and kale. Also, if patient is on the tube feeding, then also prefer to give the phenytoin medication 1 or 2 hours before or after the tube feeding because it decreases the absorption and patient have higher chances to get the seizures. Also, you have to teach your patient to take the phenytoin medication at the same time. And since it's not the metallic taste and not the photosensitive medication, so don't check by the Nclex examiner. Still, if you have any question regarding the phenytoin medication, comment down below.